Good afternoon, guys. I've got discussion aid for you. It's about mixed dementia. Okay, so we're going to discuss that for A. Give me a minute to set up for the show, and I will be right with you. Thanks. Back up. Just a little. Somebody can see me. Okay. Mixed dementia refers to causes where someone has more than one type of dementia, most commonly a combination of Alzheimer's disease and vascular dementia. Other combinations can include Alzheimer's with Lewy body dementia. This phenomenon is more common than previously believed, especially in people over 75, but often goes under undiagnosed or mistaken for pure Alzheimer's. Why it matters. Misdiagnosis or under recognition can lead to missed treatments for the secondary type of dementia. Okay, Alzheimer's may be treated with uh, choline Zister inhibitors, while vascular dementia management focuses on lifestyle and cardiovascular health. Donepezil is noted as a common treatment option for mixed dementia cases. Call to action. The earlier dementia is diagnosed, the better the outcomes. Awareness around mixed dementia can help drive more tailored interventions and improve quality of life, quality of care. Would you like to dive deeper into how this intersects with frailty aware models or smart housing strategies you've been exploring? I'd love to connect the dots. Mixed dementia. Explore telehealth platforms for remote monitoring and supports. caregiver well being, practice self care, and seek respite when needed. Burnout uh, under burnout undermines quality of care. Join support groups, access resources from organizations like the Family Caregiver Alliance or National Alliance for Caregiving. Would you like to explore how these strategies could be tailored to memory friendly housing or frailty aware care models? I think your expertise could really elevate that conversation. Okay. Use calm, reassuring tones and maintain eye contact. Respect refusals and reframe requests gently if needed. Engagement and stimulation. Incorporate music reminiscence, therapy, or familiar rituals into ADLs to boost mood and participation. Encourage gentle physical activity like chair exercise or walking to support mobility and independence. Technology integration. Use medication reminder apps, fall detection wearables, and smart home devices to enhance safety and autonomy. Use adaptive equipment like easy grip utensils, dressing aids, and pill organizers. Arrange furniture to support clear pathways and reduce fall risks. Cognitive and emotional support break tasks into simple step-by-step instructions using visual or tactical cues to reduce confusion and anxiety. Offer choices to preserve autonomy, e.g., would you like to wear the blue shirt or the green one? Digital dignity preserving techniques. Approach care with empathy and patience, especially during intimate tasks like bathing or toiletry. Okay. A pivotal role in supporting daily living activities, ADLs, especially for individuals with mixed dementia. Here are some thoughtful, evidence informed strategies that can make a real difference. Personalized assessment. Begin with a functional evaluation to understand the person's strengths, limitations, and preferences. I use tools like the CATS Index, Independence in ADLs, or Lawton Body ADL scale to guide care planning Environmental adaptations. Install grab bars, non-slip mats, and motion sensor lighting to enhance safety. Mood stabilization through therapy or medication can reduce apathy or aggression, improving engagement in daily tasks. Limitations and considerations. Some interventions show limited long-term carryover, especially if not personalized or uh, consistently applied. Traditional ADL assessments like the CATS or Lawton body scales may miss subtle changes, so continuous uh, granular monitoring is key. Would you like to explore how these findings could inform adaptive housing design or caregiver training models? I think your expertise could really shape a more responsive care framework. Caregivers play mobility and reduce neuroplastic neuropsychiatric symptoms like making dressing, bathing, and walking safer and more manageable. Cognitive remediation has shown small but meaningful improvements in instrumental ADLs like shopping, using the phone, and handling medications. Multimodal interventions combining music, physical activity, and cognitive stimulation can stabilize or slow decline in both basic and complex ADLs. Behavioral and emotional support. Psychotherapy and occupational therapy help with coping strategies, routine building, and task sequencing, which are crucial for maintaining independence. Significantly influence activities of daily living, ADLs, but the impact depends on the type and combination of interventions used. Here's how they play out. Cognitive medications. Drugs like donepezil may help preserve memory and executive function, which supports tasks like uh, managing finances, cooking, or remembering appointments. These improvements often modest, but can delay the decline in independence. Lifestyle and non pharmacological therapies, exercise programs, especially aerobic, and strength training may enhance comfort through evidence. Evidence is still emerging. Important notes: no no FDA approved drugs specifically target mixed dementia. Treatments are usually tailored to the dominant symptoms and underlying causes. Early diagnosis and personalized care plans are key to improving quality of life. Would you like to explore how these treatments could be integrated into frailty aware or memory friendly housing models? I think your expertise could really elevate that discussion. Great question, and one that really gets to the heart of care planning. Treatments for mixed dementia can, hold on, heart healthy diet supports vascular health. Think Mediterranean style eating, cognitive stimulation, activities like puzzles, music therapy, or reminiscent therapy can help maintain mental function. Sleep hygiene and stress reduction, meditation, consistent routines, and calming environments are beneficial. Therapies, occupational therapy helps with daily functioning and safety. Psychological psycho, Psychotherapy supports emotional well-being and coping strategies. Alternative therapies, aromatherapy, massage therapy, and light therapy may offer the diagnosis. They may help with memory and cognition. Let's see. Memantine can be used alone or with uh, cholestein inhibitors to support cognitive function. Blood pressure and cholesterol medications, crucial for managing vascular contributions and preventing further damage. Antidepressants or antipsychotics, sometimes used to manage mood changes, aggression, or hallucinations through uh, cautiously, cautiously, lifestyle interventions. Regular physical activity improves blood flow and may slow cognitive decline. The dominant symptoms and contributing conditions. Would you like to explore these distinct impact care planning, or frailty aware housing design? I think your expertise could bring a powerful lens to that conversation. Treating mixed dementia requires a multifaceted approach because it involves more than just one type of dementia. Most commonly, Alzheimer's disease, and vascular dementia. Uh, while there's no cure, here here are the most effective strategies currently available. Medications. Progression may be less predictable due to interplay or different disease progresses. Often goes undiagnosed until autopsy, as overlapping symptoms make it harder to distinguish clinically. Treatment differences. Alzheimer's treatments focus on slowing cognition, cognitive decline. Cholester inhibitors like donepezil, vascular dementia management, emphasizes cardiovascular health, controlling blood pressure, cholesterol, and diabetes. Mixed dementia may require a combination of approaches tailored to its most common form of dementia. Accounting for 60 to 80% of cases. Progresses gradually and predictably over time. Mixed dementia involves more than one type of dementia, most often Alzheimer's combined with vascular dementia. Causes by reducing blood flow to the brain. It may also include elements of Lewy body dementia or frontal temporal frontal temporal dementia. Symptoms can be more varied and complex, including memory loss, mood changes, movement issues, and hallucinations. Environments. I think your insight could really elevate that conversation. Mixed dementia and Alzheimer's disease share overlapping symptoms, but they differ in their underlying causes, progression, and treatment strategies. Here is a clear breakdown. Alzheimer's disease caused by abnormal protein buildup, amyloid plaques, and tau tangles that disrupt brain cell function. Typically begins with short-term memory loss, then progresses to confusion, disorientation, and difficulty with language and reasoning. Functional decline. Difficulty with daily activities like dressing, bathing, or managing finances. Repeating questions or misplacing items. Trouble interpreting visual information, such as depth perception, because symptoms vary depending on which brain regions are affected, which type of dementia are involved. Mixed dementia often mimics Alzheimer's early on, but many progress more rapidly or unpredictably due to vascular contribute, contribute, contributions. Would you like to explore how these symptoms may influence care strategies in memory friendly housing or frailty aware care? Okay, behavioral and emotional changes, mood swings, depression or apathy, personality changes such as increased irritability or withdrawal, hallucinations or delusions, especially in if Lewy body dementia is involved, sleep disturbances, including acting out, dreams, REM sleep, behavior disorders, physical and motor symptoms, balance and coordination issues, slower movement or stiffness, particularly if Parkinson's traits are present, unsteady gait or frequent falls, bladder control problems in some cases. Symptoms can be quite complex because they affect a blend of multiple types of dementia, most commonly Alzheimer's disease and vascular dementia, but sometimes also Lewy body dementia or others. Here's a breakdown of what to look for. Cognitive symptoms, memory loss, especially short term memory, difficulty with language, including finding words or following conversations, poor judgment and decision making, confusion and disorientation, even in familiar settings, trouble with planning or organizing and completing tasks. Okay, so that is it for you. I'll be back on with B shortly. For now, Gator Wellness. Take care.